Hello YouTube, my name is Felix, and I was the one that asked the question at Politicon a week ago. I was at Ben Shapiro's event, and I asked him a question on healthcare, and I wasn't really planning on making a follow-up video. I just wanted to ask my question real quick and then get out of there and then just kind of go about my day. But then, the next thing I know, I hear about this video that he posted up on his YouTube page on the Daily Wire. So, it's just really, really strange. I don't know how to describe it. Just watch for yourself.
How's it going, y'all?
I'm actually one of the people that disagree with him, and that's why I came here today, so... Yeah.
Have you ever seen him?
Yes, I have, and I've been trying to ask him a question for like years
What's the
now.
question?
I am curious to know why you continue to deny that universal health care is an effective system.
In my view, the best of all available systems would be a wild deregulation of the healthcare system itself, leading to lower costs, higher quality, and then what's left over can be filled in with relatively minimal investment.
Yeah, so a lot to say about this. The fact of how they cut it in such a comedic way for their podcast, it's just, I don't know. Like, here, let's start with the interview that happened at the very beginning. So first off, I was waiting in line at Politicon to go see Ben Shapiro. I was talking to a bunch of other conservatives as well. And this woman by the name of Cassie Dillon, I actually didn't even know that she worked for the Daily Wire. If I had known, I probably would not have done the interview. But anyways, I did the interview anyways, and she was asking us all our names and why we were here. And of course I said, well, I'm here because I disagree with Ben Shapiro. Now, she's asking me, like, oh, what's the question that you're going to ask him? So that's where the video cuts off. Now, if the video had continued, you would have seen that I had said, oh, I'm going to ask him about universal health care. And the first thing that she says to me is, oh, well, what about the DMV? And I was like, what does the DMV have anything to do with healthcare? I was trying to think about that for a while, and I was like, okay, so are you assuming that the government would run healthcare like the DMV? And I'm just like, no, those are two completely separate categories. Like, DMV has nothing to do with healthcare. And so then she goes on by saying, oh, but what about Venezuela? And I was like, well, why are you bringing up Venezuela? I mean, this country has a bunch of problems. Right now they have a horrible sewer system. They do not have clean water. It's a variety of different problems. It's like, just because they claim that they have universal health care doesn't mean that it's actually working there. So, I was trying to bring up countries where universal health care is working, like in Japan, and Singapore, and France, because those are the three main countries that I would personally support. Now, her argument against that was, oh, but those are small countries. And I'm looking at her like, those are not small countries. I mean, Japan is not a small country. And then she says, well, Japan is smaller than America. And I was like, well, okay, so fine. If you're going to talk about big countries, what about Indonesia, for example? I mean, they're just implementing universal health care. They should have full coverage by next year. They've already seen a decrease in infant mortality and an increase in life expectancy, despite the fact that 40% of the people there are smokers, and somehow are able to achieve better health quality. And as soon as I said that, of course, she goes, oh, well, thank you for your time, and then just moved on to the next person. So, I mean, it kind of goes to show you that the conservatives don't really have good arguments, anything against universal health care. I understand that maybe you have one system that you think that might work, but you really cannot deny that universal health care is probably the most efficient system that is out there. Well, anyways, here was the question that I asked. Hi, you're a hard man to reach to. I'm glad I made it today. My name's Felix. I have a question for you about healthcare.
All right.
I disagree with you on this issue. We spend more on per capita than any other country in the world and have some of the worst results. According to the World Health Organization, we were 37th in 2000, 49th in 2009, and 50th in 2010. We also lead in mortality amenable to healthcare with over 45,000 people that will die every year because of it. The top 17 countries, and I have the list right here, that have the best healthcare in the world uses some form of universal healthcare, whether that be single-payer or two-tiered system or a government-mandated program. I am curious to know why you continue to deny that universal healthcare is an effective system. And before you answer the question, I personally would advocate for a two-tiered system, not single-payer. Yeah, so as you can see, I didn't come there like guns blazing, like, why do you deny the rightful name of universal healthcare? Ooh, like, no. I actually came up there with facts, and I backed up my facts with sources. and I claimed that universal healthcare is an efficient system. It has worked with the top 17 countries with the healthiest people in the world. And I was just asking him an honest question. I said, why do you continue to deny that universal healthcare is a system that works? And then, of course, I cited my view of what I think a good healthcare system is, and I said a two-tiered system. I know I pronounced it wrong in the video. I was a little tired that day, but I preferred a two-tiered system over a single-payer plan, and this is his response.
Okay. So the answer is that it depends on what you're going for. Really, it does. So there's a couple reasons. Well, let me put it this way. Here's the framework that I use when I'm thinking about healthcare. Before that, just organizing my thoughts here. Before that, the first thing to mention is that all of the countries that are doing really well on healthcare also were doing well on healthcare before the implementation of a nationalized healthcare system. It's not the national healthcare system that changed Sweden into a healthy country or Norway into a healthy country. These were healthy countries before that happened. That's just the way it is.
So, wait, is he talking about the days before Big Pharma or, like, the days before Medicare? Like, he's not really giving me, like, a good timeline towards what he's considering what was healthy countries before they implemented universal health care. And in fact, you can even talk about more recent countries like Ireland, for example, which used to lead in mortality amenable to health care with 134 deaths per 100,000. But then after implementing universal health care in 2005, that rate actually decreased to 78 per. Now, I've already talked about Indonesia, but you can even look at going as far back as many other countries like Japan, for example. Now, Japan, and I'll show you the chart right here, it says here that in 1947, the life expectancy was less than 55. For men, it was like around 50. Their healthcare was horrible back in the day, but then when they finally got universal coverage in 1961, you can see how much that health has spiked, and it has been growing ever since. In fact, it has been growing higher than the United States rate is. So when he says that these countries were already healthy before universal healthcare, there is no facts, there's no data that would support that. I mean, it is preposterous.
The United States is mainly unhealthy because we eat a bunch of shit here, right? I mean, that really is the reason. Our diet is really different than it is in, for example, Japan or in Norway, where people tend to exercise more and are healthier as an overall metric.
Now, it is true that our country does eat a lot of shit, but obesity is caused by a lot of other factors. You know, it could be genetics, metabolism, insulin. It just all really depends on your cells that are in your body. He's making the argument that you really can't take care of Americans because they're already fat. And it's like, well, I would argue the fact that we could take care of obese people if they were to have more access to universal health care.
So comparing populations is not like, it depends on where you are comparing. If you compare Norwegians in the United States to people who live in Norway, my guess is you probably wouldn't see an enormous difference in the level of health care obtained. Number two, the United States healthcare system is a disaster area. It's actually the worst of all possible worlds. It is not a free market system, and it's not a totally regulated system. It's somewhere in between, which means it's heavily regulated and heavily subsidized, which leads to increased costs. That's why it's so expensive.
That's also not really true because most other countries are actually more highly regulated and subsidized by other countries, especially like you look at Japan and France and how they have regulated their healthcare systems and preventing businessmen from taking too much profits out of their hospitals. In fact, even in Japan, they only allow doctors to run hospitals, not businessmen. And that sort of strategy initializes and says that, hey, we're not going to allow people to make profit out of sick people. It's just like, it's not ethically right. So that's the problem. I mean, we are one of the only countries that allow pharmaceutical companies to charge whatever they want. I mean, in any other country in the world, it's like the prices are significantly less because the government is much more involved. They are much more highly regulated, and they subsidize their healthcare through all of their citizens.
When we say that we're spending an enormous amount per capita, we should define who the we is. The we is not the government. The we is the government plus private expenditures on healthcare.
Now, Ben just shot himself in the foot in this argument here, which actually makes absolutely no sense, because this is the exact argument that liberals have been trying to make for years. For years we've been trying to say that the private healthcare system is way too big. They spend they're involved in our lives way too much. It's just what we're trying to do right here is to try to lower the privatized system and to allow more government involvement. Now, the more privatized the system is, the more prices soar. Now, Singapore, for example, tried giving freedom to hospitals to compete, believing that the free market will drive down the cost, but what they found out was that hospitals were buying expensive technology. They were charging more for doctors and decreasing services for the lower class patients. So the free market doesn't lead to lower costs. It actually leads to the increasing costs.
Now, it's my decision whether I want to spend a lot of money on end-of-life care. It's my decision whether I want to spend a lot of money on immediate care. So it's not quite a one-to-one ratio the way that people are making it out to be. And that's why in the United States, for example, when it comes to 5-year cancer survival rates, we actually rank #1 in the world. That's because you actually have availability of health care if you can pay for it. The question is, how do you bring the cost down?
Now, he uses the example of the 5-year cancer survival rate, but when you actually look at that chart, you'll see that countries like Canada are actually only lower by 1%, and they actually have free health care. Not to mention that, like, Japan leads in stomach cancer survival rates and other things as well. Now, the thing is, he tends to be really, really picky on these sort of facts. Any sort of facts that would, like, help support his arguments, when he should be taking facts as a whole. So, well, now, the World Health Organization would measure healthcare ratings by life expectancy, infant mortality, access to healthcare. There's a variety of different things, but just because America leads in one of the issues of health doesn't make the healthcare system any much better than other countries.
So, now to my model of how I think about healthcare. Dan McLaughlin in National Review puts it this way. He says you can have 3 things in healthcare. You can have affordability, universality, and quality. Those are the 3 things that you're looking for in healthcare. Every system can guarantee no better than 2.
So let's talk about his source here about the picking 2 of the 3. It comes actually from Dan McLaughlin, who is a lawyer and not really a health expert. Now, it really depends on your definition of affordability. So, for example, a $30,000 car may be affordable to you, but it's not really affordable to me. So when we talk about, like, the definition of affordability, I mean, you really can't have affordable health care unless you are going to go for a full single-payer healthcare system. But even then, you know, it's just a variety of definitions between what you're going to say what is affordable and what is not. Now, there are countries like Japan and Singapore that can have all 3. Now, in a 2-tiered system, the government, in like Japan and Singapore, they will pay 70%, and the rest of it falls in the hands of the citizens, or the private insurance. Now, depending on your income, the government may decide to pay 80, 90, or even 100% of your healthcare system, but that really is also, again, dependent on how much that you make. So, when you're talking about choosing 2 of the 3, I actually think you can have all 3 if you're using a 2-tiered system. Now, not everyone can have affordable, quality health care, but that is an incentive to get people to work harder so that they could be able to afford their own private health care insurance.
So most of the systems that you're talking about, if they are universal, they are not affordable in the sense that the government does rack up enormous surcharges on that basis. Now, that may not be as much as we're spending here, because as I say, we have the worst of all available systems. We're not free market and we're not nationalized. But Canada's healthcare system is extraordinarily expensive. Britain's healthcare is extraordinarily expensive. Norway's healthcare is extraordinarily expensive, which is why the tax rates on people in the middle class and lower classes is still exorbitantly high. Like, the United States actually has a far more progressive system of taxation than Switzerland or Sweden or Norway. Right? All of those countries have income taxes of 60% for folks making about $60,000 a year. It's really, really high. There is a cost to it.
Actually, he makes a mistake here. Switzerland's income tax actually doesn't exceed 40%. The taxes there are actually much incredibly lower than what you would expect. Now, Sweden and Norway does have high taxes, but those are not countries that I would be personally referring to or systems that I would advocate for. And I've already told you that I would personally advocate for a 2-tiered system with Japan, Singapore, and France as probably your primary examples of how American can use their systems effectively with our systems as well. So now, these countries still don't spend as much as Americans do, as I've said before in the question, that we spend more per capita than any other country in the world, but have some of the worst results. Now, when Ben talks about now Canada's healthcare system as being expensive, I don't really see the evidence of that. I tried looking for it, and it's just not there. In fact, they pay half the price on their pharmaceuticals that we spend, and we spend more per capita in healthcare coverage while being taxed virtually at the same rate. Americans and Canadians spend the same rate in taxes, so it doesn't really make any sense why he's trying to say Canadians' healthcare systems is really expensive. There's no evidence for that. Now, there's also an increasing in doctors per citizens in Canada, with more doctors coming into the country than out of the country. Now, obviously, Canada has problems, and I don't personally advocate for single-payer healthcare system, but it has been proven to be a much more efficient system than America's.
Now, the question is, what are you looking for? So what I am looking for is affordability and quality and not universality. Universal health care is good if you're looking for universality. If you're looking for universality and affordability, you don't spend a lot of money and you ration health care. You see some single-payer systems that are like this. If you're looking for universality and quality, then you don't care that much about affordability. You just spend an awful lot of money on it. And if you're looking for quality and affordability, then you have a free market system, because that's what free markets generate. They can generate near universality, but not complete universality. This is true for food products, for example. It's not true that everyone has equal access to food, but food is extraordinarily cheap in the United States and very high quality, at least what you can get. So the question is, how do you wish to define the balance between rights and duties in a civilized society? My answer is I want affordability and quality, and I want social fabric picking up the rest, particularly at local level and hopefully before you get to the governmental level. The problem I have with the universal healthcare system is that it tends to drive down supply of doctors and nurses unless you spend exorbitant amounts of cash, right? You have to import people from other countries to do that work. This is what's happened in Britain, where they're importing a lot of their healthcare system from India, for example. Or you have to spend enormous sums of money. So
if you listen to what he's saying there, when he's saying that Britain is importing a lot of healthcare from India, yeah, so what? I mean, there are a bunch of doctors that are immigrating from one country to the other all the time for a variety of reasons. I mean, the fact that there are doctors actually coming into the United Kingdom because they want to practice in this country is actually probably destroying his argument more than helping him. So yeah, it's called free trade. You know, when you want to import healthcare from other countries, people do that all the time. Now, lobbyists in America actually are preventing that from happening. There are other states that actually want to buy pharmaceuticals from other countries, but for whatever reason, because it can only be done by the federal government. The federal government is actually preventing Americans from actually being able to purchase medicines from other countries.
Are there nationalized healthcare systems that are better than ours? Yeah, there are. Australia is better than ours. Switzerland is better than ours. And I agree with you. If you were going to do this, you would want a two-tiered system, right, which is more like Switzerland. But in my view, the best of all available systems would be a wild deregulation of the healthcare system itself, leading to lowered costs, higher quality, and then what's left over can be filled in with relatively minimal investment.
Just one thing. Can I email you with some responses?
Sure, absolutely. Thanks.
So I did follow up with him on an email. I still have yet to hear back from him. In the end, though, I am actually really glad that he didn't use his two very main arguments. He always says that his wife is a doctor, for example, because then I would have came back and I said, well, my dad's a health insurance agent. What does that have to do with anything? Because it's like Ben Shapiro's wife does not speak on behalf of all Americans. So, and plus, I highly doubt that she has written articles or published anything in the American Health Journal. So it's just that it's a sort of an irresponsible way of citing your sources. And then the other thing too is that he always says is that it's like pointing a gun to a doctor and saying that you're going to have to force that doctor into performing healthcare. And it's like, what country in the world does that? Like, unless you're talking about North Korea, or like, I don't know, like, but there is no country that I know, no developed country that is forcing doctors to perform healthcare. I mean, they can charge whatever price that they want. That is true. In Canada, in most countries, they can do whatever they have a lot of freedom. Thank you for watching this video. I appreciate your time going through this. I hope, again, that Ben Shapiro, Ben, please respond to this, because I'm a little bit frustrated with you right now, and I'd like some clarity on these issues. Thanks.